I have a question about chiropractors. During pregnancy, I hear a lot of people like, I'm going to go get my back fixed or whatever during pregnancy. And from a doctor's perspective, is that good or bad while you're pregnant to go see a chiropractor?
Well, personally, I don't encourage my patients to see chiropractors while they're pregnant, mostly because the experience that I've had and heard about with chiropractors are it's not the same thing as going to a physical therapist or even an osteopath, which I am, by the way, but it's more high velocity and more aggressive. I don't think chiropractors do a lot of things that have to do with, soft tissue massage or, stretching or something like that, where I feel like in pregnancy, those are the things that you should really focus on. I have plenty of people that have like sciatic pain or low back pain. And there's things I recommend. There's physical therapists I send them to. There's osteopathic practitioners I send them to. But I just feel like there isn't something in the realm of chiropractics that has a method of making something better, that there's not already something better to do for that ailment. Plus, every once in a while, everybody hears about a major incident at a chiropractic place, like they manipulated somebody's neck and, tore a vessel, which is rare. I get it. But still, if there's not really something specific that they can offer you as a pregnant person, I tend to avoid them.
What about for infants and small children or even children in general? Because I hear a lot of natural people say, oh, baby's not latching on properly, or baby's not eating right, or something like, oh, baby's not pooping. I've heard this too. Baby's not pooping very much. Take him to a chiropractor and they'll be pooping. Take him to a chiropractor and they'll be latching and all this stuff. And I'm like, what? Take your little baby that's not even, their bones aren't even formed, to a chiropractor?
I couldn't imagine why that would be a thing. Like what would there be about manipulation of bones that would even be safe or necessary for a little baby or a kid? So, I tend to seek out my answers elsewhere. And I know there are people who swear by it, but, I have had a little bit of experience in, many years ago, maybe going to a chiropractor. I didn't feel, it feels good sometimes for somebody to really crack your back or, try to unstiffen you when you're really kind of stiffened up from maybe being in the same position. I can tell you, after I do a C-section, sometimes if it's really difficult and I've been kind of hunched over and not paying attention to my posture, and then when I get out of there, I just feel like, oh, somebody just needs to crack that back and, make it go back into place or whatever, even though that's totally not scientific. But other than that, and my husband can do that, other than feeling that, I don't see a benefit for either pregnant people, babies, or kids.
Okay. One of my quasi pet peeves is OBs or doctors who dismiss patients' discomfort during pregnancy and don't offer them any avenue for relief or treatment or anything. People who have sciatica, people who have pain in various ways. How do you handle referrals to physical therapy? Do you encourage people to tell you right away when they're having problems and not suffer, for weeks and weeks on end?
I do try to gauge what would be considered a normal pregnancy, like, oh, my back hurts a little bit, because if that is the case, like I said, I am an osteopath. I often teach people, this is how you can do a pelvic tilt safely during pregnancy. This is how you can, stretch your legs. This is how you can lean into a corner and stretch your pectoral muscles if they feel like they're getting tight. So I have, during my training, I did lots and lots of hands-on stuff. Plus, I don't know, I'm sure I told you this before, I was a physical therapist before I went to medical school. So it's in there somewhere, years of OBGYN practice. I haven't done it a lot as far as this is my main treatment when someone comes to see me. But if it's more than that, if it's more than me teaching them an exercise or a stretch or a way to protect their back, then I very readily refer to several different physical therapists in my area. One, to regular orthopedic physical therapists if I really think it's an orthopedic issue, like maybe a low back problem or shoulders or, hands, carpal tunnel, things like that. I refer to my favorite sports and orthopedic physical therapists. And then I do have 2 physical therapy groups, one that's pelvic floor physical therapy, which people can do while they're pregnant, but often the issues are not the same as why I would normally send to pelvic floor. And then I have a physical therapy group that treats a lot of women and pregnant women. So I refer to those 3 places a lot. Plus, I have my own knowledge and favorites when it comes to pregnancy belts, like support belts that people can wear, plus belts that support just the sacrum. There's a particular belt with a particular name that I have little pads, to give them the name of it, and they could look it up online. I don't sell any of that stuff in my office or anything, but I give them the names and the referral. I think every one of my pregnant people ends up wearing a maternity support belt at some point in their pregnancy because, I'll face it, I wore one all 3 times I was pregnant. I thought it was great. I'm a thin person who had a lot of low back pain once I had a big belly in front of me. And so I tell them what to look for, how to fit it, how to wear it and when to wear it. And I also have a lot of patients who need just general exercise advice, like what kind of exercise can I do when I'm pregnant that's safe for me? And I can give them some of that advice, but I also have other people that I can refer them to, put them on a good, safe prenatal exercise program. My nurse practitioner who works in my office actually teaches prenatal yoga. So we send to her. So it's kind of, again, just like the rest of my practices, it's very complete as to here's all the different things you can do for all your different problems and pick one.
Majority of people that get pregnant afterwards, we have the gap, the gap between our abdomen, and a lot of people are not getting treated for it. And I've even gone in and mine's gotten so bad. I ended up having a hernia. I ended up having hernia surgery. Now I might be having more hernia stuff going on. And I've just been like, can I get this treated? And they were like, well, when you had your hernia surgery, you could have had it surgically, whatever, but don't have more kids because it's not whatever. And I was like, oh, I'm glad I wasn't offered. But at the same time, I'm like, I want this like this, but nobody's like treating me, and I've heard you can go to therapy or whatever, but I was like, why are we not getting treated for this? Why is this not like common practice for us to be like putting our bodies back together after birth? It's like, oh, it's fine. You had a baby.
Well, it's kind of one of the reasons that one of my big pieces of advice that I'm probably this broken record is that when people come to me before they ever get pregnant, I have a lot of advice for them as to what type of exercises should you do. And again, no guarantee that any amount of exercise is going to make it better for you, because once you're pregnant, a lot of that abdominal, muscle strength goes by the wayside. But the stronger your abdominal muscles are when you go into pregnancy, the better they will be afterwards. And unfortunately, those rectus muscles, they're these 2 strap muscles that are just down in front and they're not attached to each other. So there's a little gap in the middle. And if during pregnancy, they just move away from each other, then the contents of what's behind them will push through when your belly is that big, when your uterus is that big. And if I do a C-section on somebody, I do sew them together so that they stay together. But there's a lot of controversy about that too. A lot of people say don't do that because that causes very painful healing if you stitch rectus muscles together, because you cut off some of the blood supply in your stitching. And that's very painful. But we don't really have any other way to put it back together. And, there are thoughts on binding it, putting an abdominal binder for a certain amount of time after the pregnancy is over. But there's no real evidence on if you do this exercise, you will eliminate your diastasis, So that is something that you do have to deal with, I would say, through physical therapy and exercise. But if there's any kind of surgery or anything going to be, they're right. It should be after your last kid.